everybody. I welcome you all from our foundation, Colorectal Cancer Research Foundation and Indraprastha Apollo Hospitals. This is a public lecture, and the topic we've kept is colorectal cancer in India, the rising trend, how to curb it. And the program is that initially we have a lecture for around 25 minutes. This will be followed by 10 minutes talk by some of our patients, and then a panel discussion for 40 minutes by eminent panelists. We have in our panel, we have Dr. Saket Govil, who's a senior consultant at Indraprastha Apollo Hospital, surgeon. Dr. Yogesh Batra, who's a senior consultant gastroenterologist at Indraprastha Apollo Hospital. Dr. Vivek Tandon, who is the head of the Department of GI Surgery at the Metro Hospitals, Noida. Dr. O.P. Sharma will be joining us. He is a head of the Geriatrics Department at Apollo Hospitals. And Dr. Anita Jatana, who is a dietitian at our hospital. And so I think without wasting much time, we should be starting the talk. And the topic of the talk today is colorectal cancer in India, the rising trend and how to curb it. We, in fact, have chosen colorectal cancer because we probably have a passion towards it, although the incidence in India is not as high as in the West, but still it is a condition which, if diagnosed in proper time, can be treated completely. Patients can be almost completely cured of the disease. In cancerous diseases, we don't use the term 100%, but it is almost 100% that they are cured and they can lead an absolutely normal life. So that is why we felt that there is a reason to be aware about this cancer, which is increasing in our country. So I'll be talking about this cancer under these headings. What is colorectal cancer? Why we've chosen the month of March for this talk? Then the incidents and trends in India. Are you at risk? How to identify that? How can we prevent it or try to prevent it? When should you be consulting a doctor? And what are the tests for early detection of this cancer? How can we diagnose it? Staging and treatment, and conclusions. So now coming to what is colorectal cancer. Colorectal cancer is a cancer which is affecting this part of the intestine. This is the large intestine, as you can see. This is the cecum, the ascending colon, the transverse colon, and the descending colon, the sigmoid colon, and the rectum. So this is the large intestine, this part is the colon, and this part is the rectum. So the cancer affecting any part in this colon is considered as a colorectal cancer. And majority of the cancers, as you see, are in the distal part of the colon, of the rectum, like almost 38% in the rectum and 20% in the sigmoid. So almost more than 50-60% form the distal colorectal cancer, whereas there are 10 to 20%, 15% in other parts of the colon. And this is the part which is the most tricky one even for management, basically. So, and the symptoms also are usually different if you have a tumor in this area or this area or this area. So these are this is called as a colorectal cancer, just to show you a little, not to scare you, it's a normal intestine. These are the normal folds of the intestine. And this is an ulcer, which is a cancerous ulcer. Like this is also a part of the intestine, the rectal part, and this is the cancer where we've removed the complete rectum. Don't assume that everybody knows about this cancer. Try to raise awareness in your community. Don't assume that it will happen by itself. Give your own time and volunteer to make a difference in your community. So this is the theme of this year's Colorectal Cancer Awareness Month, Don't Assume theme. So that is why we thought 1st of March, keeping this lecture, is probably an apt time to have this lecture as a public lecture for awareness regarding this cancer. Coming to incidence and trends regarding this cancer, this is a cancer which is fairly common in the West. In the US, almost colorectal cancer is considered as the third most common cancer in men and second most common cancer in women. The incidence worldwide is almost 1.2 million cases a year, which leads to mortality in almost 6 lakh patients a year. In USA alone, the patient number is almost 136,000 with a mortality of 50,000. As you can see in this, the cancer is mainly in US and South China, other areas, Australia. These are the common areas where the cancer is much more rampant. In India, the incidence is much less. It's in the second zone that India has this almost 7 to 9 per lakh population we have a cancer. This is the same showing mortality, which is also proportionate to the incidence of the cancer. In India, the studies are not many regarding the statistics, but whatever are available relatively, approximately the incidence rate is about 7 to 9, depending on male and female, 7 to 9 cases per lakh population, whereas in China and USA it is 16, 28.5, and maximum incidences in Korea, where 56 patients per lakh are there in every year. But the trends in India are definitely changing. As you can see, in native Indians also it has been rising. Initially the incidence was 4 to 5 per lakh, now it is almost 7, 8 per lakh. And gradually it is rising. And we are seeing more and more of young patients developing this cancer. And it is, in fact, a study said that in immigrant Indians, if they migrate to UK and USA, the incidence rises rapidly. So that means that it's not in just Indian thing, it is something which is acquired also. So there are a lot of acquired factors which are responsible for these cancers. So that is why we feel that probably if we can take care of those acquired factors, we might be helping in reducing the incidence. The absolute burden overall has increased in India also during the last 3 decades. And this we can see very frequently in although we have a tertiary care hospital, but still the incidence is significantly high and we are seeing more and more younger patients.